So, Jamie, in response to your question about the pronation supination occurring at the foot and at the subtalar joints as well. So, we'll go back to our foot model that we looked at before, and we've got our tibia, fibula, talocrural joint right here. And then, if we look at from the side, the lateral side, we can see subtalar joint here. So it's the subtalar joint where most of our inversion and eversion movement happens at the ankle. So remember, inversion, sole of the foot is pointing towards the midline. Eversion, sole of the foot is pointing away from the midline. When we look at pronation, supination, so our normal gait pattern is we heel strike, our weight will shift a bit to the outside of our foot, and I'm exaggerating here, and then our weight shifts through to the inside of our foot, and we toe off, and we'll look at that from the side as well. So we heel strike, our foot hits the ground in mid-stance, and our weight shifts to the outside of our foot. We're in supination, weight shifts to the inside of the foot, we're in pronation, and then we toe off. So when we look from behind at that pronation and supination position, pronation where the weight shifts to the inside of the foot, most of that pronation movement comes from all of these midfoot joints through here. But there is a little bit of calcaneal eversion that happens at the same time. So the calcaneus is everted to allow that pronation position. For supination, where the weight shifts to the outside or the lateral side of the foot, we're going to have a little bit of calcaneal inversion that's happening. So the calcaneus is pointing slightly inwards towards the midline of the body. So again, pronation, supination, most of the movement's happening through these midfoot joints, but there is a little bit of calcaneal inversion and eversion that happens at the same time.